All right, everyone, welcome in. We're gonna get the room ready and started. So please, everybody, like and share the live. Salam, everyone. Please like, share the live. We have our special guest event right now. We're about to get started here in just a little bit. Please share to all your friends, share in the discords, wherever you are active. We have special guest Dr. Mimi Syed joining us today, and we are very, very, very excited. She is absolutely amazing, and this is going to be a very educational and eye-opening live for everybody. So please invite everyone. We'll build the room up in just a bit, and we will get started. Let's see. Are we doing mod announcements?
Hi. Salam.
Salam, salam.
How's it going?
Alhamdulillah, alhamdulillah.
Alhamdulillah. Guys, everyone like
Okay.
and share the live. Join the team. Even if you're already a member, send your orange heart. You're supposed to send one every day.
Yes,
Check the
please
live.
click on the orange heart. We know there are, people that are watching that do not want this information to be shared out. So please, please, if you can help with, if you're not a subscriber, definitely subscribe, help with the gift goal, whatever it is that you are able to do in the next 1 hour. That is how long our event will be. So please, please, please make sure to do your part, whether it's by sharing, liking, clicking the orange heart. And once we get enough viewers, inshallah, when we build the room, we will bring our guest up. Salam.
Wa alaikum assalam. How are you all?
Alhamdulillah, how are you?
Alhamdulillah.
Alhamdulillah. Guys, yes, like Taz just said, let's get the likes up to 10K. Let's share the live out to 500. Hit that orange heart. Throw some team bracelets. We got to keep the chat positive. Let's protect the live throughout all of this because there is going to be a lot of information being discussed that nobody wants to hear about.
hmm Send a team bracelet. Send a team bracelet. Yes, please, guys, please. Share the live out. Hold the screen down, and you're going to see like a list of people. Just share it with everyone and drop it in any Discord you can.
And yes, and then also for my mods, I'm going to just limit the mods for now during this event for all my super mods. And then also like they said, please share this out. Very, very, very important. And I'm going to be having a Q&A session. So anybody who does like to ask any questions, please request and we'll try to bring as many people up as possible. But salam everybody and welcome in. We'll get started here in about 5 minutes. So appreciate you all for being here and very, very excited to have Dr. Mimi Syed with us today. She is absolutely phenomenal and the work that she has been doing. I also will be putting her Instagram account, so please everybody make sure to follow her and make sure to support her because she is doing wonderful, wonderful work for Gaza. So I'm going to post that here, right here. Make sure you guys, let me know if you guys see that. So make sure you guys follow and we'll go from there. But I will be, as soon as we build the room here, we'll be dropping everyone. And if you are wanting to come back up to ask questions, please request. Salam di.
My love.
Also, guys,
And if
everyone request to boost the live as well. That does help. If everybody's requesting, that helps to like boost the live and the engagement. And Taz, if you want to make your screen big.
yes, and let me know if you don't want me to bring you up, but yeah, let me do this. Perfect. Thank you all for being here. And then just again, let me know if you guys do want to come up. Otherwise, just let me know in the chat if you're just requesting to boost. continue, guys, to share the live, and we'll get started, inshallah, in 5 minutes.
Salam to everybody coming in. Guys, please share the live out. Hit the orange heart at the top. Gift team bracelets. Let's keep the chat positive and remember to protect the live.
Yes, for everybody coming in, welcome, welcome. We have a special guest live today, and we'll be getting started here in about 5 minutes. Please engage, continue engagement, whatever you can do to help with the algorithm. We want to get this out. Alhamdulillah, all of our events have been absolutely phenomenal. The information is viewed by hundreds of thousands of people. So, alhamdulillah, you guys are doing absolutely amazing. And for anybody who wants to rewatch this, I'll be posting highlights and then also be posting this on YouTube. So just it's a little bit of a slow process, but we'll get there. So I know a lot of people said, please make sure if we're not able to make it that we want to watch it. Almost there, guys. About 3 minutes. We'll get started. And then if you guys are on Discord, please share it out in the Discords. We would really appreciate that.
Guys, welcome in. Hit the orange heart at the top of the page. Send team bracelets. Level up the points. You're going to see something that says Team Quest. Hit the Team Quest. Send out the gifts that help get Taz on the FYP. Unfortunately, if you're in the United States, you still can't subscribe. But if you're outside of the United States, you can send subs to everybody else, whatever the hell you could do to move the room along. We want to get this on the FYP. Taz works really hard to get guest speakers lined up and times arranged and everything and so forth, right? So let's do the what we can to protect the live, do all the things that TikTok likes, right?
All
W.
right. W, thank you, Dee. Thank you, Linda. Thank you, Ahlam. Our guest is here. So I am going to drop you guys. If you want to be on the panel to ask questions, please request. And again, everybody that is interested in coming up, I see so many people requested. I just don't know who wants to come up. So please just let me know. And we are going to get started here. All right. Hello, Dr. Syed. Do you hear me?
I hear you, but I don't see you.
Okay, just give me a second. Let me see. Okay, just give me about a minute or so, and then we'll be able to request again. Thank you
Are you
guys
able to
all for
see
being
me?
here. Not, yeah, I don't see you yet, so I'll
Oh,
have
okay.
to resend that, and we'll do that in just a second. But we have our special guest here, everybody. Please make sure you share it out, get the word out. This is very, very important information that you guys will be hearing. Please make sure you follow Dr. Mimi Syed on her Instagram. I have that in the banner up here. And that way you can engage with her content and her projects moving forward. Then we'll go from here. Let me try to request you or open my camera. Just give me one second
Taz,
and let me know if it
Salam alaikum.
works.
See if you can change the layout a little bit. It's
There you
kind
are.
of cut off.
If you put, there we go. Yeah,
Yeah,
there we
I
go.
see it.
That should be good. All right, everyone. Welcome, welcome. Thank you all for being here. Please continue to share the live, everyone. Engage and positive comments, of course, whatever you could do to protect the live. We have today Dr. Mahmouda Mimi Syed. Dr. Mimi Syed is a board certified emergency medicine physician and an assistant clinical professor at University of Washington and Washington State University. She is a fellow of the American College of Emergency Physicians. Dr. Syed served in Gaza from August 8th to September 5th of 2024 and December 3rd to December 31st of 2024 at both al-Aqsa Hospital and Nasser Hospital. Welcome in, Dr. Mimi Syed. We are so honored to have you here with us to speak and for us to hear about your, both medical missions and your message to the world and the work that you have been doing. Thank you again for joining us. I wanted to start off by asking you, how did your experiences differ between your first medical mission to Gaza and your second visit in December? I know they were a few months apart, but what did you see in terms of differences?
Yeah, thanks for having me, Taz. Yeah, I mean, I left in August, and in August, it was the worst thing that I couldn't have even imagined that it could be that bad when I was there in August. But when I left, I never imagined that it would be worse when I came back. When I came back, it was significantly worse. I mean, the level of destruction was more than anything I could have imagined in my career. And it's hard to articulate in words just how destroyed Gaza is until you actually see it and you're on the ground. But it's not like anything that anyone has witnessed. I had several kind of veteran trauma surgeons with me that had been in all sorts of conflict zones around the world for years. And all of them, hands down, said this is about the worst thing that they had ever witnessed. Nothing even came close to Gaza. So.
Now, in terms of hypothermia, a lot of I know that during that time that was something, and famine. What can you tell us about what you witnessed during in December specifically as the months got colder?
Yeah, I mean, I think when I was there, there was about six newborn babies that had died overnight in tents. And it was, you have to understand what it's like there. So there are tents, and when we say tents here, it's like a canvas, proper tent. That's not what a tent is there. They're made out of scraps of cardboard, plywood, anything really that the families can get their hands on. That's what they're making their dwellings with. And this is, a wet environment because it's rained, it's right by the sea. And then on top of that, you're making it very cold at night. And babies aren't able to keep insulation. They can't keep warm, right? Like adults, you and I could probably keep warm. They don't have that physiology to stay warm. And so what we were saying, and that same goes for elderly patients. They just don't have that ability physiologically. And newborn babies were just dying because there was nothing that could keep them warm. The Kogat, which is the Israeli military, denies entry of any building material into the area. So even if families wanted to purchase and build something more substantial for their families, that just wasn't available to them. So they were just left with, whatever they had, blankets and cardboard, whatever they could get their hands on to make some kind of shelter for them, and which is obviously inadequate in those temperatures. I was there, and I had a coat that I had brought with me. We had blankets and sleeping bags, but there was no heat inside the hospital. That's where we were living. And even then, we were so cold. We were freezing cold. Our hands were always cold. We were just freezing cold. So I can't imagine a baby at night sleeping by the sea in this, what we call a tent. It's just unimaginable.
Yeah, I can't
And then
imagine. Go
yeah,
ahead.
your question about famine. So when I went in August, things were pretty limited as far as food goes. But the NGOs that we went with, the organizations, they had provided food for us, and they were able to feed us well. When I went back in December, even the NGOs couldn't get their hands on anything that was, considered good nutrition. So we were getting about 400 to 500 calories a day as an adult, and that's us as an NGO. So if you can imagine, someone who doesn't even have that support. So that's why we were seeing the malnutrition, the malnourishment in children, especially children, because they need certain types of nutrients, which was completely lacking. Protein was completely like just non-existent in the market. So we were seeing a lot of delayed wound healing. So especially in small children, one of my colleagues was treating a child that had shrapnel injuries, and those injuries just wouldn't heal. So they would remain fresh all the time. And that was common, even post-operatively. There were wounds that just would not heal because they were, such lack of protein. And so I think we got like a shipment of eggs while we were there. But each egg was like $3 or $4, per egg. That's impossible for people who haven't been working for 15 months. It's impossible to buy that. So.
Yeah, I can't imagine having to witness the hypothermia, like you mentioned, you witnessed six babies, we say like unalived, or lose their lives because of hypothermia due to the weather. Um, Now, we've seen reports of healthcare workers being directly targeted by Israeli forces, as well as those involved in protecting humanitarian aid. During your time in Gaza, did you feel that medical personnel were being deliberately targeted or threatened by the IDF? And did you personally feel safe?
Oh, yeah, absolutely. I mean, none of us were safe. None of us are safe, right? We give ourselves this false sense of security when we're there. Historically, if you look at conflict zones and humanitarian aid workers, there is a sense of immunity for these workers. And, they're not targets. They're not supposed to be deliberately targeted. Gaza is unique in that the healthcare workers, humanitarian aid workers are deliberately targeted. So, like in the beginning, healthcare workers were afraid of wearing scrubs because they were afraid of being shot by a drone sniper. When I was on the roof one day at Nasser Hospital in August, there was a drone that was kind of circling around, and I was trying to call my husband because there was, better reception on the top of the hospital. And then there were shots fired. I didn't realize it was being fired towards me. One of the surgeons came and grabbed me and brought me down, but no, and that's just me. I was just there for 4 weeks, so I can't imagine what it feels like as a healthcare worker to be in Gaza, knowing that you're a target. You look at the ambulances. Every single ambulance has gunshots or bullet holes inside of the ambulance in the windshield. And every single time I'd see that, I would ask the ambulance, like, "Hey, what happened to your ambulance? Why do you have this damage to it?" And every time they'd say, oh, it was a sniper or a drone tried to, shoot us, a quadcopter shot us, or a tank or something. So it's, that completely obliterates the healthcare system. And we've seen this, Dr. Abu Safia was illegally arrested and abducted. We don't even know if he's okay. He's not allowed lawyer access, and nobody has contact with him. And this keeps happening. This has happened to so many healthcare workers that are currently detained without any reason, illegally. So yeah, this is a deliberate targeting of the healthcare system. We've seen it time and time again. Nasser was under siege in March of last year, and then al-Aqsa was bombed just probably like 3 weeks before I got there, on the hospital grounds. So this is, this is an obvious target. Healthcare workers, healthcare system is an obvious target.
Yes, and this kind of goes into my next question about like the psychological state of the care workers. So what was the psychological state of the healthcare workers you encountered in Gaza? And additionally, like I wanted to ask you, after witnessing these events firsthand, how are you coping personally?
Yeah, I mean, the healthcare workers, like I was able to do a comparison, right? In August, I went and you could see people are just exhausted. They're exhausted. They were working at that point, about a year into it without pay. These are all volunteers, without pay, coming to the hospital every single day and witnessing the most atrocious things that you could ever imagine in your life. I mean, not even in your worst nightmares you would imagine. And they're witnessing this day in, day out, day in, day out. And so you had a sense of like compassion fatigue as well, which is a coping mechanism to extreme trauma. So I saw that in August. When I went back in December, there was an even more significant sense of hopelessness. And you can see that in every healthcare worker's eyes is just complete exhaustion. And, like the world has turned their back on them. This is a population that has been completely annihilated from the very foundation, and nobody's done a thing. The superpowers of the world have just continued this bombardment. And um, even despite that, I have never witnessed the level of kindness that I did with the people of Gaza. There's just a complete acceptance. As an NGO worker, you're supposed to wear a vest, and that vest has an American flag on it, because we're all coming from, most of us are coming from American NGOs, and despite that, even before I went there, I was like, oh my God, I don't want to wear an American flag. I can't imagine they're going to hate me. No, despite that, they would come up to me daily. People would come up to me daily and say, thank you for being here. We know that you are not your government. And thank you for standing with us. Thank you for leaving your life and your family and your security and coming here and standing in solidarity with us. So, yeah, it just demonstrates this level of just humanitarianism in these people that I never witnessed it anywhere else. And the healthcare workers themselves, I mean, they embody what the Hippocratic Oath is. They have demonstrated that what true medicine should be, the morals behind a physician or a healthcare worker. That's what they practice. They don't give up. So their psychological state, I can't even imagine how they feel. I was there only 4 weeks at a time, and I will never recover. I don't think any of us will. We just kind of keep moving forward and try to do the best we can in stopping this madness. But when none of us will be the same again. We can't ever forget what we saw, and we can't be silent about it.
Wow. Um, I think I heard you once mention on a different video that PTSD amongst the healthcare workers, and to kind of, if you can elaborate more on that. I know you're saying we can't, will never be the same, but I think, are they able to continue to do the work the same after witnessing everything from their PTSD?
Yeah, I mean, given that they're so resilient and strong, they will. They will. There's no question about it. But I get messages from people that are still there, a lot of my colleagues, and first of all, they have nothing to go back to. So a lot of people, when they opened up they did ceasefire. A lot of the people went from the south back to the north where they were from, and they went back to rubble. So they have nothing to, imagine being a healthcare worker or anybody. I mean, imagine being anybody with a profession, a job, or anything and going back to rubble to live in. You have no shelter, you have no car. Uh, Everything that you ever knew is destroyed. So just imagine what that feels like, and that psychological toll that it'll take on you. Hopefully they'll be able to recover, but a lot of so like a medical student that I was really close to just messaged me the other day, and this is about the most hopeful person I could ever meet. And she said to me, we're just going to wait to die now. That's what we want to do. We want to die, because that's going to be the easiest thing out of this. And I said, I was pretty puzzled. I'm like, well, what do you mean? If there's a ceasefire now? She's like, yeah, well, they're going to kick us out. We're not going to be allowed to go back in to our country or to our land. And so what's the point? So, I mean, you can't even describe how psychologically the turmoil that people must feel. But you're mentioning mental health, and something to point out is a lot of my colleagues have witnessed as children. A 5-year-old child saying that they want to die, that it's better to be dead than to be alive. That is the most abnormal, unnatural thing I have ever heard of in my life. I mean, it's completely, it's not natural. It's not normal to hear a 5-year-old say they want to die. But that was one of thousands of children. I mean, all the kids there, so a lot of them don't speak English. So we would have crowds of kids around us, and they would make these gestures with their hands, like a bomb dropping on them, like, and saying they're happy because a bomb dropped on them. That's what they want. So it's made that the living conditions for people, but specifically children, so bad that they would rather die than be living in those conditions. These children have all of their whole families are dead, their moms, their dads, and a lot of them, there's no living family around for them. So, and then they themselves have witnessed other children dying around them, their friends, other kids they're seeing with these traumatic injuries, amputations. There's the largest population of child amputees in Gaza than anywhere else in the world. Um, and so the children, they see that. And just imagine how that feels as a small child, that this could be my fate. Oh, I'd rather die than that be my fate, you know? Um, so that's just, like a description of what it's like.
It's, I mean, it's heartbreaking to listen to, but you're right. This is the reality of what's on the ground. And I think people need to listen to this and hear this. Um, and I know you're doing a lot of work even after leaving Gaza back in December, and you recently lobbied at the UN and met with Secretary General Antonio Guterres. Could you share insights from that meeting and what ongoing efforts are you pursuing to for to support Gaza and to help Gaza?
Yeah, I mean, we were in DC prior to that. That same week, last week, we went to DC, spoke to some congressional offices and staff there. But after that, for the last part of the week, we went to the UN in New York City. Um, and essentially, just we had some talking points. So there were some specific requests. We met with the Secretary General. We were very grateful for all of the UN staff that met with us. We actually got a very receptive and positive response from everybody there. Some of our talking points were about medical evacuations, especially for children. There's about 2,500 kids that need urgent evacuations. That's a very low number, because those are just the children that are on a list that somehow made it to a list that we are aware of. But there's thousands of other kids that still need medical care that haven't even made it to the list. So our specific requests were around that to kind of get a pathway and some sense of organization to evacuate the most urgent children. Um, but additionally, our asks were for right of return as well, because that directly affects the medical evacuations as well, right? You know, examples are, a child needs to be evacuated and can go with her mother as a companion, but mom can't return for her other kids, and those other kids are not allowed out. So, imagine as a mother making a decision to leave one of your children behind. I mean, that's just, I have three small children. That's impossible for me to imagine that. So it creates this barrier and this hindrance. And I can't imagine what reason, what reason the Israeli government would have to deny these children evacuation or to allow them to have companions that are just children. I mean, it's mind boggling to me, but, um, it doesn't pose a security risk. There's no other reason other than to just be cruel. But those are some of the asks that we had, and then UNRWA. UNRWA has been defunded by the U.S., or the U.S. part of it at least, and our ask was for the rest of the UN governments or the countries to kind of fill that gap. And it honestly felt embarrassing as an American citizen. I was born and raised in this country. It's embarrassing as one of the most rich countries of the world to go to other countries and say, hey, can you please fill this gap that we've left, this void that we've left in UNRWA, and other foreign aid. UNRWA is historically the backbone of Palestine, especially Gaza, down to the education, English. We had a physician with us, Dr. Ali, who is a spinal surgeon, that was born in Gaza and was a child when he came to the US, but he was a product of UNRWA. He learned English through UNRWA schools. He got food through UNRWA aid, and then came to the US, was trained at Yale, and now serves in an underserved community in Texas as a spinal surgeon. So that's what UNRWA,
Wow.
that's the poster child of UNRWA. And so, none of those nefarious claims about UNRWA, being involved with any kind of terrorist activity, none of that came. There was no validity to it. It's all been debunked. And so this continual denial of UNRWA being a solid source for the Palestinians is it's cruelty. And then just having all of the recovery, the rebuilding of Gaza, to involve the Palestinians in it, because outsourcing that and kicking out the Palestinians and then rebuilding it, that's just not, it's not humane, first of all, but it's also it's not in the interest of anyone. Empowering the people of Palestine, giving them the resources to build their own country, That's the way to go. And that's what we've been kind of talking about at the UN as well.
And this meeting was all before what we heard Trump come out and say about removing the Palestinians from Gaza and,
Right.
basically ethnically cleansing them. So I know I did see that the Secretary General did condemn this, and had a response to that. But how can I know you're doing a lot of work. How can everybody here, there's, almost 250 plus people here listening. What can we do to help you and support you in your
I
ongoing
mean,
efforts?
yeah, I mean, the stuff that people do, everybody has their role. I was just talking to a colleague this morning on my way in. Everybody has their role and what they need to do. As physicians, we've witnessed because we're the only independent, foreign workers that are allowed in. There's no journalists that are allowed in. So we've witnessed and we can talk to what we've witnessed. But outside of that, I think what you guys are doing right now is raising awareness, talking about it, changing the narrative. That's what we need to understand, is changing the narrative is about the most important thing that we can do collectively. The rhetoric is that the dehumanization of Palestinians. We need to humanize in the eyes of the rest of the world that Palestinians are, first of all, they're humans, they're human beings, and their
Mhm.
children are just as important as any other child in this world. And so doing that, there's just so many ways to do it. I've seen so many beautiful things by people that I could never do. I could never be an artist. I've seen artists do things that humanize the Palestinians. Musicians do that. So all of us have a role, but it's to change the narrative. This is not about religion. This is not about politics. This is not about race. Most of us, we don't even have ties to Palestine. I'm not Muslim. I'm not Palestinian. I'm not Jewish. I'm not Israeli. I have no ties to that, to Gaza, to Palestine. But this is about humanity. That's what we need to focus on. This is not about religion in any way. And I think that sometimes we lose focus. And, obviously, the people of Palestine are Muslim. And so naturally, there will be more Muslims going to help other Muslims. But I think that it's important to realize, to remember what the biggest message is. This is not about religion, right? This is about human beings. This is about children. And sending that message out is extremely important. And just remembering the overall goal. The overall goal is to humanize Palestinians. The overall goal is for the world to see that it doesn't matter what color your skin is or what religion you are, but killing children, a 50% population of Gaza is children. This is a war on children. That's what the world needs to see. And that's the truth. It's factual information. There is no subjectivity to it. That's what we've witnessed. Numbers don't lie. Over 70% of the cases that we saw as physicians were women and children. I went back when I went in August. I came back and I tallied the type of patients that I saw, the demographics, and like 86% were children. So, whether someone's a sniper shooting them in the head or the chest, it doesn't matter because if we're dropping 2,000-pound bombs on children that are living in tents, that's still a war on children, right? That's still deliberate.
Yes, absolutely. And I had just two more questions. You kind of already answered one of them, but I'm going to just ask this. The shrapnel that you were finding in the children, what did it look like, and what times and hours of the day were these being used on the Palestinians in Gaza?
Yeah, I mean, shrapnel injuries are really common. There's the random shrapnel that you would find, pieces of metal. I think one of my colleagues actually found shekels, it's pretty disgusting. But as
Shekel,
shrapnel,
the money.
yeah, the shekels, the big heavy coins. So those were used sometimes in bombs. But um,
Oh,
we were seeing these cube-shaped shrapnel, very common, that are made out of tungsten, from the education that I was able to get about it. But they're dropped from missiles, and what they do is they disperse. And the times that we would notice them, and a lot of times, and when I went in August as well as December, we would notice them around times of congregation. So people, when they're together, when their families are together at night, usually in the evenings when they're in their tents, and The shrapnel is such that it kind of enters the body, it cavitates and just destroys the path that it takes. And so it's very difficult. For example, a child, if they were to get that in their artery or one of their organs, to stop that bleeding, because it creates this type of it tunnels through and creates this cavitation. It's very destructive. And even I've seen one kill a child, because it went into their heart, caused some bleeding. I mean, I have an ultrasound of that. That I saw a child that came in, one little shrapnel just killed him. And so very destructive munition. And we all saw it. I was able to, we would routinely just kind of take it out of patients' bodies. We would find so many of them, we'd take them out. But they're uniformly cube shaped. And I think other physicians have talked about it too after they returned.
Absolutely horrific. I mean, we know we watch videos or we hear stories, but to, hear it from you and what you witnessed is a whole eye-opening for everybody. And my final question, which you actually already answered, but we're going to kind of end with this from my questions and give it a chance for everybody else to ask, was what message would you like to share with healthcare workers, parents, and the global community?
Yeah, I mean, I've said this a lot in interviews too. I mean, to be silent is to be complicit, right? If you look the other way, if you bury your head in the sand, you are just as guilty. And and that's the most evil thing I can imagine. And not just healthcare workers. I'm talking about parents, teachers, anybody who's a advocate for children. If we can't agree that targeting and killing children is wrong, if we have to have a conversation about that, uh, I mean, it's scary to, as a mother of small children that I'm raising, to imagine a world where it's okay to kill a child, to deliberately kill a child. Um, and it's not just healthcare workers. I mean, healthcare workers specifically, because we take an oath, right? We have this, we serve humanity. We are protectors of humanity. It is our job to speak up when humanity is violated. And as a healthcare worker, that should be a no-brainer. You should be saying something. But as a mother, I see a lot of influencers and things that are claimed to be mothers that care about children and all these causes, and it's like, what have you said about the children of Gaza? Nothing. Or women's rights, people who are influencers regarding women's rights. What have you said about the mothers? There's a 300% chance of miscarriage as a mother in Gaza now after October 7th. So where that's completely has to do with women's rights. So it's I think as a human being, you need to say something, but specifically, you're right, healthcare workers, mothers, teachers, advocates for children. If you haven't said anything, please, say something, because you are just as guilty. And I mean, there's nothing more to say about that. I think it's a no-brainer.
And I want everybody to take this message and share it to everyone and anyone that they know. Please make sure you guys follow Dr. Mimi Syed on her Instagram account. I have it right here in the banner, Dr. Mimi ER. Thank you very much, Dr. Syed, for answering my questions. I'm going to open up the panel. I know we only have an hour today, so we have about 30 minutes for some questions from the audience. And I'll start first with Brother Mo Pesci here at the top. Please, for all the guests, keep it to one question so that everybody is able to come up and ask any questions.
First of all, thank you so much, Dr. Sayed, for all that you did. I really appreciate it, and so do I know the thousands and thousands of Gazans you've helped, as long as us in the diaspora. So really, I appreciate you. Thank you very much. I wanted to know, as a doctor, working under such strong conditions. We had Dr. Perlmutter here and we had Dr. Sidwa here, and they kind of emphasized the same thing that you did, recognizing pattern of to the types of harm and trauma that you were seeing. They recognized the same thing. What sort of excuse me? What sort of difficult ethical decisions can you recall having to make with the overwhelming number of patients, with obviously the amount of limited, I should say, the under amount of limited resources that you've had?
Yeah, that's a good question. We daily, so we would have to decide who lives and who dies, right? So a mass casualty incident is basically like you. I don't know who the audience is. I'm sorry, but I would assume you don't know what that is. But that's when a lot of patients come in at the same time. And mass casualty incidents, you're not supposed to get mass casualty incidents more than once a day, usually. That's what we're trained for. In Gaza, you get them multiple times a day, and each of those mass casualty incidents have dozens and dozens of patients in them. So up to upwards of 25, 50, 100. 100 was like one of the most that I saw when I was there in Gaza. And they all come in at the same time. So there was a bomb that's dropped, then the quadcopter goes over, shoots people, and then all the patients come in. So, and at the same time, right? There's parents bringing their kids in, there's ambulances, there's cars, donkey carts, whatever people can bring their patients in with. They come in, and most of them are laid on the ground. And you have family members there, so you're trying to kind of fight through a sea of people, and terrified mothers, people looking for their family members, and um, most of the people are dead usually, right? They're children that are brought in dead, laid on the ground. But a lot of these people are come in critical. They come in very critical. So usually during these incidents, we have kind of like a basic triage system, and we would tag them, not physically tag them, but mentally just kind of make a note. Okay, this is a red, a yellow, or a black. Red is a very urgent patient that we could save. Let's do something right now. Yellow is minor, not so, they will do something, but doesn't need to be done now. And then black is essentially this is a lost cause. Let's not expend any resources on them. So routinely we would get people with head injuries, and a couple of cases that we had where brain matter is out of the skull. And these would be like shrapnel injuries. So we can't do anything for them. But every once in a while, you would have to make a decision. And in August, I had a decision to make, and then again in December. And we did this multiple times. But there was a child that came in, this time in December when I went, December 4th. An 8-year-old child came in with the ambulance. She had part of her brain sticking out of her skull. She was hit by shrapnel injury and was deemed to be basically don't salvage, don't do anything for her. But she was still moving around. So I made the decision, despite, being told, please don't do that, which is not unreasonable in situations like this because we have no resources. I did intubate her and I put her on a vent. So I put a tube in her throat to breathe for her, was able to save her life. We had a neurosurgeon that was able to help her. And that child, actually, a few weeks after that happened, I was still there in Gaza. I got a video from her dad. She was reading a book and she's walking. She sent me a message saying, "Thank you, doctora. Shukran, doctora." And it's those are like the type of situations, and then the what ifs that you're thinking about. Because I think now, oh God, I should have done that for the 5 other kids that I saw then too. So it puts you in this position that no person should ever be put in, and it's unnecessary, right? If I were to be able to bring in all the medical equipment that I can, maybe I could have saved more lives. But COGAT denies all that. The Israeli military does not allow you to bring that in. And they don't allow any kind of medical equipment to be brought in by even aid workers.
Thank you for answering me. God bless.
That's phenomenal. I mean, thank you for all the work that you do. I mean, that story, it really just touches your heart listening to that. And may she thrive and grow to be an amazing woman, inshallah. Go ahead, Didi.
Doctor, thank you so much for being here. Taz, as always, thank you so much for putting in so much hard work to have such a great lineup. And thank you for what you did for my people. I am Palestinian. I very often, we as Palestinians have to work to humanize ourselves. We just face so much dehumanization, where it's constantly, one of the things that we'll hear very often is that Palestinians don't appreciate life. They don't want life. They don't care for the lives of their children. They want martyrdom. What I'd like to ask you is, did you see anything when you were there that would contradict that? And would you be able to give us a specific instance? You just gave a story, but I'd love another if that's okay.
Oh yeah, no, that's actually the opposite. I can't. I've never heard that, but you're probably right. That's the way that they probably use to dehumanize Palestinians. But No, it's the exact opposite. Palestinians love life. When I was in Gaza, I mean, they would make this, they would make they would make do with anything. There was a group of children there that would follow us around. There, a lot of them were orphans. They were around the hospital grounds, and there was about a dozen of them, little kids. But they would follow us around all the time, just kind of, we would give them lollipops or balloons, and they would be so happy. But one day was December 24th. I remember it was Christmas Eve, and they prepared an entire spread. Um, an entire spread, a dinner for us. It was me and a couple other physicians with the very like little food that they had. It was aid food that they were able to kind of get their hands on. And they made this entire spread for us just so they can share a meal with us. And they knew that a lot of us were foreign. Maybe we celebrated Christmas Eve or something. So they made this entire spread for us. And they were so happy for, because of their efforts and how proud they were of themselves that they were able to give us something. These are the most grateful people I have ever seen in my life. Even the smallest things. There's like specific desserts there that they make kanafi, and you know this better than I do, Dee. But they were making it with like ground up breadcrumbs, like the pita, because the pita is like you can find that. But because there was nothing else to make it with, and so they would make do with that. A simple little cup of coffee, they would just make it so fancy and give it to you in the midst of like rubble. If you visited someone's home, they would make you feel so special with the very little that they even had. So these are not people that just want to die. These are people that hold on to any shred of life that they possibly can. And are so grateful for it. That couldn't be further from the truth. Yeah, absolutely not.
Yeah, absolutely. And there's a saying that says, "We teach life, sir." I don't know if you're familiar with it, but that's exactly uh, correct. Um,
Yeah.
Thank you so much, Dee, for your question. Um, Go ahead, Ahlam.
So Taz, I know you said one question. Do you mind if I ask just two super duper quick ones?
Go ahead.
Okay, cool. First, Dr. Mimi, I just want to say thank you so much. Honestly, I'm sure you know, a lot of Palestinians want to be doctors and engineers, to help their people. A lot of my family members are doctors and nurses specifically to help our people. So, seeing doctors who are not Palestinian go out of their way for us is always really touching. So I wanted to thank you for that and let you know that we really appreciate it, us in diaspora and our family in Palestine as well. Um, so the first question is, I know you work with an organization, and you had mentioned that, they're able to provide you guys with food while you're working. I just want to know what the organization is so that, we can support them and donate, to keep more doctors being able to go to Palestine, to go to Gaza and the West Bank.
Yeah, I can give a list of various organizations to Todd. She can share it with you guys too. But Palestinian American Medical Association is the one that I went with in August, and then Med Global in December. And there's many others. There's Fajr, there's Rahma. They all do amazing work. And yeah, I mean Heal Palestine, GLIA. There's a ton of others, and they do great work. I mean, just not just like bringing foreign doctors in, but they also do a lot of community outreach. Med Global does a lot of outreach for maternal care and things like that. So you wouldn't go wrong donating to any of those, really.
Okay, awesome. Because, like there's organizations we can donate, but when it comes to aid, Israel stops the aid or steals some of it. So when it's with doctors, I really love to support like Doctors Without Borders, stuff like that, where we know people are getting in to actually help. Isa, I wrote down some of the names, and she's going to also share it with Taz. So we'll definitely share that to everyone. And then my final question was, I was just out of curiosity. When you were there, did you see any polio cases, and were you able to assist with them? Did Israel provide any support? The US provide any support? Was there anything that got in to help?
So polio was the vaccination was rolled out in August. When I think it was during the last week that I was there in August. I never saw a child with polio. There was one case while I was there. I worked specifically in the trauma unit when I was there, and so I didn't see a lot of the medical cases per se. That doesn't mean they weren't happening. I just wasn't there because there was so much trauma. That's what I was dealing with because that's what I specialize in. They were there. I mean, and to mention, the polio vaccine, people are really hyped up about the polio vaccine and other vaccinations and things, but let's ask ourselves why there's polio there. That should be the discussion. There shouldn't be polio there. There wasn't polio there. The polio is there because of this annihilation of cleaning, of sanitation, of clean water. The living conditions are dire. All of this is man-made. So you can give all the polio vaccines you want. If you continue to bombard and shoot and drop bombs on Gaza, then these polio vaccines are pretty useless. And it doesn't address the bigger question. It doesn't address why we have polio in the first place. So, that's kind of what I want to highlight. Yeah, your question, did they roll it out? They did. They rolled out the polio vaccine while I was there. They did a really good job. The NGOs that were there, they would go out into the community and give the vaccines, but at some point they started bombing those areas, and so they were no longer safe to go out and give it in the community. So the patients had to come to the hospital. But I wasn't really involved in the rollout of the vaccine. But yeah, I mean, I always people ask a lot about that vaccine, and I'm like, well, let's talk about why we need the vaccine to begin with. And another thing I want to mention that I forgot to mention when I was talking is, this rhetoric of, oh, the hospitals are being bombed by the Israeli military because there's Hamas inside of it or there's terrorists inside the hospital. I just want to, I know you guys probably know, but we lived in the hospital, right? All of us lived in the hospital for 4 weeks at a time. I was there twice, two different hospitals in two different times of the year. Never, I mean, I'm not even like exaggerating, never did I see a militant, a combatant, someone with a gun, any weapons inside the hospital, any kind of funny business. We had access to all parts of the hospital. We lived there day in and day out. We never even saw any injured people come in that were militant or combatant. All of the people we saw were civilians. They came in with their families. So that whole narrative of, we're bombing it because there's someone inside the hospital that's a terrorist, it's garbage. It's just not true. It's simply not true. And it's important to mention because I think that's obviously the excuse that's been used to eradicate the healthcare system there. So.
Mm. Wow, thank you for highlighting that and for, bringing that up because that is something, like you said, that is used in every conversation, in every justification of what they're doing by Zionists. So thank you for saying that. There's about 300 people here. There's a lot of Zionists that do listen to these lives. There's a lot of Americans that do listen to these lives. Western, from all over the world. This is so important for everybody to hear. So thank you for mentioning that. And I want everybody to just W Dr. Mimi Syed in the chat. Please flood that. Thank you, Ahlam, for these really great questions. We'll go to Eucalyptus.
Hi, Dr. Mimi. It's a pleasure to meet you.
Thank you.
Oh, thank you so much, not just for the service for the Palestinian people, but, these crimes that were committed against them, they're considered crimes against humanity. So this service that you did is for all of humanity. When I heard you speak earlier, you were talking about how you would be afraid to live in a world where your children could be a target, and that's the reality that we're living in now. So I'd like to ask you a series of questions real quick. Yes or no will do will do fine, or just a short answer, please. So I'd like to ask, you some questions that you've already answered too, just for the sake of time's sake, right? So I'd like to ask, what hospital did you work at while you were inside of Gaza?
So I worked at Nasser Hospital in Khan Yunis the first time, and then second time I was at al-Aqsa and Nasser in Deir al-Balah. Al-Aqsa is in Deir al-Balah.
Between what dates?
The first time was August 5th to September, I'm sorry, I get those dates. August 8th to September 5th, and then December 3rd to December 31st.
Okay, at the time that you worked at these hospitals, did anyone who came into the hospital with injuries report that they were harmed by age group?
No, no, these were always like airstrikes or shrapnel injury or things like that. That's what we witnessed anyway. That's what were told. Obviously, we were not in the field when the injuries happened. So,
Okay, I'd like to ask, did you witness any Palestinian mothers celebrate the unalivement of their children?
no.
Okay, so in the time period that you worked at these hospitals, did you witness any H group warriors fire pew pews or rockets from inside or outside of the hospital?
No, I just addressed that. You know, we never witnessed anybody like that. Militants, combatants, anything that even resembles. I mean, and usually in war zones, you know, you have someone come in from the military that's injured, because hospitals don't discriminate, physicians don't discriminate. I would treat anybody that walked in. I never witnessed it. I just never saw it. And no, none of my colleagues, you know, one of the physicians that was on your show before, Dr. Sidwa, did a poll of physicians in the New York Times and asked actually all of them, American doctors. Nobody ever witnessed it. They just weren't there. It's just, I mean, I don't know what else to say about that.
Okay, well, I heard you speak a little bit about how when you were on the roof of the hospital, you went up there to use your cell phone, you were in scrubs, and you were fired at by a quadcopter. Was that the only instance? Was there any other instances that you experienced shelling by the Israelis? I am aware, by the way, that there is like an application with a dot on the map for you. It's like a green light or red light. The other doctors spoke to us about that. So, first, the Israelis were aware that you were inside of this hospital, correct?
Oh, they know where we are all the time. We have to share our location with them, so they know. Like that's the whole part of the de-escalation process. So they know exactly where you are every single time. I mean, you know, I can't speak to anyone's intention. I could give you the scenario, and you can decide with logic what that means. But if you see someone and then you see the dot and you're shooting towards them into the building or at the building that they're standing by, then I don't know what you want to think of that. Either way, it was a harmful situation. But you know what? When you're crossing the border, like when you're crossing the checkpoints, the guns that the Israeli military has, they point it at the aid workers while they're putting their bags on the conveyor belt, so as to kind of be intimidating. And so that happens regularly. That's, you know, there's a lot of harassment involved there too, intimidation, harassment.
Okay. Other than the pew pewing on the roof, what other shelling did you experience at the hospital while you were there?
I mean, we would hear munition all the time, right? We would hear tanks and things like that, drones firing, all sorts of things.
Okay. Well, thank you so much for your time. I wanted to, since I asked so many questions, I wanted to keep it in a short time frame. Thanks again. I appreciate you and I appreciate everything that you've done.
Yeah.
Thank you. We call this his rapid fire questioning. So thank you, Eucalyptus. Go ahead, Linda.
Hi, Dr. Mimi. Like
Hi.
everybody else on the panel, I want to say thank you for your humanitarian work. I actually have two questions. One was asked in chat regarding how the shekels were placed in the boom booms.
Oh, I don't know how they were placed, but they were coming in with those type of shrapnel. One of my colleagues found it, not me myself, but he had shown me a picture of it, that he had a person come in that had a bunch of shekels inside of him after an airstrike. So it's just heavy and it's metal, so it can obviously be destructive.
Thank you. And considering you've worked with trauma, my question is regarding what we've come to know as Gaza syndrome, right? Which
Yeah,
is
and you're right. I'm sorry, I'm seeing the chat. Yeah, you're right. It could have been debris. You're absolutely right. It could have been in their pocket too. But when you're seeing a bunch of them in different people, I don't know. You can make your own conclusions. It doesn't matter.
Thank you. So regarding what we've come to know as Gaza syndrome, which is ongoing PTSD, can you recall any specific cases with the children, and what are the long-term effects of this trauma?
Oh, and children. I mean, this is going to be lifelong, right? And you're creating a generational trauma because of this. Yeah, there's a lot to say about that, obviously. But if you have children witnessing death around them all the time, and most of them, if they've lost their parents or their families, you have that there's a whole lifetime of recovery. And not only that, if they ever have children themselves, they're gonna that trauma gets passed down. That's called generational trauma. So it's creating a unstable, population, because children are going to be that future, right? If they live to be there. And not to mention, not just psychological. There's debilitating things that have been done to these children too, physically, right? They're maimed, or example, like if a mom gives birth to a preterm infant who has cerebral palsy, that's not something that goes away with a pill. Like that's a lifelong disease. So you're creating that disability within that population in the youth. So yeah, I mean, to your question, of course, there's going to be generational trauma. This is not something that's going to go away just because there's a ceasefire.
Thank you.
Thank you, Linda. We'll go to Palestini Warrior.
Thank you, Taz. Hi, Mimi, Dr. Mimi.
Hi.
I just
Hi.
want to personally thank you for your service. Um, the journalists and the doctors in my eyes are the light of humanity. And my first question is, how many, and if you did see this, how many foreign doctors were actually injured in the line of work or unalived?
In our, not in the NGOs, I don't know any, worker in the NGOs that were, none of the foreign doctors were, but the Palestinian doctors, and I mean, every single hospital had people that were imprisoned, illegally imprisoned, abducted, tortured, that were healthcare workers. I met, I think, about half a dozen of them at Nasser at the first time I went, and then again when I went in December, and these were nurses, doctors that their only crime was either they refused to leave their patients and abandoned them when Nasser was under siege in February, March. Not only that, but the fact that they were just in the hospital on October 7th, they were imprisoned, they were arrested, for like 2 months at a time, 4 months at a time. They were tortured while they were there, and then released. And this by itself causes them to not be able to work when they came back. Right? They had PTSD so bad that they couldn't even work. They couldn't even be a functioning nurse when they came back. So, I mean, in al-Aqsa, same thing. I met so many physicians, so many surgeons that were imprisoned illegally or tortured. And there's been hundreds killed as well. So, and like I said before, Dr. Abu Safia is still in prison. Still, we don't know his whereabouts. We don't know how he is.
Thank you. And my last question is, did you see any children that were so malnourished that they actually look like HCOS survivors, skin and bone? And if you did, how many of these cases were common in your area?
Yeah, so I didn't go to those wards for the children, but I did see people come in dead at Nasser that had they look like they're. I've never seen any amount that severity of malnourishment. I've never seen in my entire career. I've been a physician over 12 years, and I've never seen that. But I saw several that came in dead on arrival because they were so significantly malnourished. They had what we have temporal wasting. It's called when there's like an indentation in your temples. Cachexia is a term when you have muscle atrophy, and it is so severe it literally looks like it's a skeleton with skin on it, and that's how bad it was. So the type that I witnessed when I was at Nasser.
Thank you. Those are my questions. Thank
Thank
you
you.
so much.
Thank you, Palestini. I think we may have time for maybe one or two questions. Go ahead, Bobby, and then I know Mo, you said you may have another one. Let's try to get to that. Go ahead. Go ahead.
Thank you. Hello, Doctor. Thank you for your work. Really appreciate everything you've done for my people and for the people in Gaza. I just want to ask you if you come across any children or women with gunshot wounds. Was it? Did you come across any for starters? And yeah, that's it really.
Oh yeah, I mean that's well, I have 18 such documented cases of children with gunshots to the head or to the chest or to the abdomen. There was a day at Nasser in August where we had two trauma bays filled with young women and children with gunshots to the head. They all had single shots to the head. That's all they had, and they were shot by drone snipers. All of my colleagues have witnessed that. I mean, we saw it every day. Every single day we saw it. And these were, when you ask the family members, whoever brings them in, hey, what happened? It's usually, oh, there was a sniper, it was a drone shot them. There's a specific case. If you go on my Instagram, I talk about a lot. Her name is Mira. She's a 4-year-old little girl. She came in on August 24th. She was shot by a drone sniper in her head while she was eating breakfast in her tent in Mawasi. She came in almost dead, and of course, I intubated her and saved her life. I was able to get the neurosurgeon that traveled with us to do surgery on her. She's alive and well to this day. Luckily, but needs ongoing care. She needs medical evacuation. In waiting for that medical evacuation, her mother, Isra, was hit by a bomb in her tent and now has an amputation of her leg. So those are the type of devastating things. Gunshot wounds are very common. I had a little boy named Adam Syed, 8-year-old boy, when I went back in December. He was shot in the abdomen, and uncle said that it was a sniper from a tank that shot him. And I have that on my Instagram as well. I mean, we talk about this a lot. The pictures that were submitted in the New York Times of the skull with the bullet in it, that was Mira, that was my patient. So we've all documented it. We all have it. All of us have said this. Children are shot in the head or the chest. Young women. There was a pair of like a 15 and a 16-year-old cousins, girls that were in their tents getting ready for a pre-wedding ceremony. And a quadcopter or drone sniper came and shot both of them in the head. One shot. They came in. They both died shortly after. So this was so common. And I took pictures of a lot of things. And when I look back at a lot of them, most of them are like gunshots.
Thank you.
Thank
Thank
you.
you, Doctor.
Thank you, Bobby. Do we have time for one more question? All right, because
I'm
I know
fine
you
with
said it
it.
was an
Sure.
exactly
Yeah, it's fine.
1 hour on the dot. Okay, so Brother Mopeshi, if you want to ask your question real quick, and then we'll have to wrap it up because of the time.
Yes. I'm just curious. Number one, were you prepared, and were you really emotionally and mentally prepared for Gaza? And how did you convince your family to let you go?
Yeah, I don't think any of us could. You can't really humanly be prepared for what you're going to see. I've trained in Chicago. I was born and raised in Chicago. I worked in New York City. I saw trauma. I saw kids with trauma too, and not like this though. No one has prepared for this. If someone says, "Oh, I knew what was going to be," they're lying. It's just not possible. Nobody prepares for this. The level of trauma, specifically to children. Yeah, that's a good question. I think. I had been kind of on my phone watching it stream live, just like all of you, watching it day in and day out, seeing small children, the children that look like my own children. I have small kids, and just seeing that day in and day out, not being able to do anything, it was impossible for me. I couldn't function anymore. I literally, I couldn't do my job. I couldn't function. And the opportunity arose to come to serve. And I'm an emergency physician. I have the skills that the people need. I felt like it was a no-brainer. I had to go. And I remember I texted my husband one day and I said, "Hey, babe, I got to talk to you, And he said, "Oh, I know already. You're going to Gaza, aren't you?" So I don't think it was a surprise to him. And then the second time I said, "Hey, I got to talk to you." And he says, "Yeah, I know you're going back." So I think all of us kind of know we have to go. We have to show up. And if it's not just for the medical care, but just to even show solidarity, because we are unfortunately the only ones that are allowed in. It's a difficult conversation to have with your family. I have some family members that are still upset with me because I went and put myself at risk and continue to do so. When you speak up about this, you become a target as well. So that risk kind of goes with you pretty much your whole life. But it's just if you feel like if we think that I'm traumatized, just imagine what the people of Gaza are going through. So, why do I get to be here in my comfortable life, being safe and warm with good food, and my children safe, and the people of Gaza don't? I'm a mom, and the Gazan mothers are just the same. They deserve their children to be safe as well. So,
Thank you so much. I
Thank
really
you. Yeah. Thank you. Thank you so much, Dr. Mimi Syed, for joining us, the stories that you have shared and the insight. And I'm going to be posting, like I said, the highlights of this both here on TikTok and then the full live for anybody who missed it on YouTube. What we heard today was there's so much information, so much truth. And the message that Dr. Mimi said is to continue to spread the word, control the narrative, and continue to humanize the Palestinians as others, the Zionists and Israel, continue to dehumanize them. Please, everyone, follow Dr. Mimi Syed on her Instagram. We have almost 350 people here. Her Instagram is Dr. Mimi ER. It's right here on the screen. Please follow her and engage with her content as she continues to help out and speak up for the Palestinian cause and continue to share her message. Thank you so much again, Dr. Mimi Syed. It's been an honor to have you, and we look forward to continue to seeing the amazing work that you are doing. Thank you for being
Thank,
with us.
thank you. Thank you, everyone. Bye-bye.
Thank you, everyone, for